ACLS 2010. And this video is on cardiac arrest. So here's a scenario. The paramedics bring you a patient who they find down at a local restaurant. When they bring him to you, he has no blood pressure, he has no pulse, he has no respiratory rate. So he's what they call a 000. The question you ask yourself now is, what are you going to do about this? How are you going to manage this patient? So let's talk about that. The first thing that you're going to want to do is to get help, because you can't do this on your own. And so that might be what you call calling a code. And then you're going to get other people to get in the room to help you, because you're going to need more than one person to do this. And when people arrive, the next thing that you're going to want to do is start CPR. So that's chest compressions mostly. Put the person on, give them some oxygen, and put them on a cardiac monitor. So let's go back to our guy over here. Some kind soul has decided to come by and help you, and so they are going to start CPR for you. And they start doing chest compressions on the patient. And another person puts a patient on a mask connected to some oxygen. And someone else puts them on the cardiac monitor. Okay, so once you get all that stuff going, the next thing that you're going to want to do is, once you got them on the monitor, the next important thing to do is to check a rhythm. And if the rhythm shows that they're in either ventricular fibrillation or pulseless VTAC, then you want to administer a shock. You want to defibrillate them. So if they have a shockable rhythm, you want to shock them. Okay. Otherwise, what you want to do is to continue CPR. And we're going to want to do CPR for 2 minutes, uninterrupted. That's uninterrupted CPR for 2 minutes. And so let's just take a look at this cycle for a second before we add anything to it. So the first thing you do is you call help. You want to call a code. And you initiate CPR, or actually you have someone do it for you when someone comes. And you put them on some oxygen and a cardiac monitor, as we have here. So this guy's got the monitor and he's got some oxygen on. Oops. And then the first thing you're going to do is check a rhythm. If the guy has a shockable rhythm, that's VFib or pulseless VTAC, you shock him. And then after that, you continue 2 minutes of uninterrupted CPR. Then what you do is you check the rhythm again. If he has a shockable rhythm, you shock him. And then 2 minutes of uninterrupted CPR. Now, we're going to be doing some other things during these 2 minutes, so let's take a look at that. So the first time around, you're going to want to place an IV, or if you can't get an IV, you're going to place an IO line, because you're going to need access in order to give any drugs that you want to do. All right? So the first time you go through, while they're doing chest compression, someone else is putting in an IV. Then the next thing you want to do, the second time around this thing, is you're going to give a drug. And the drug you're going to give is epinephrine. Alternatively, you can also give vasopressin. At this time, you'll probably want to also consider an airway of some sort. Maybe intubating the patient, or putting in some kind of LMA. The next thing that we're going to do the next time around is we're going to give an antiarrhythmic, so amiodarone. And finally, the fourth time around, what you want to do is consider the reversible causes, and that's what we call the 5 H's and the 5 T's. So let's look at this again now, one more time. Right? The first thing you're going to do, call help. And then you're going to start CPR and put the guy on oxygen and a monitor. The next thing you're going to do is check a rhythm. If it's a shockable rhythm, you shock him. And then you do 2 minutes of uninterrupted CPR. And during these 2 minutes, the first thing you're going to want to do is put in an IV or an IO. Okay, so by the time the next time comes around, you're going to check a rhythm. And if you have a shockable rhythm, you're going to shock them. And so the second time around this thing, we have an IV now, so we can give them a drug. Either one of these two vasopressors. We can give epinephrine or vasopressin. And then we come back around, check a rhythm. Is it a shockable rhythm? Yes, then shock him. And the next time that we come around, we're going to give amiodarone. Then again, check a rhythm, shock him if it's a shockable rhythm, and then we're going to come back around, and these times we're going to consider the 5 H's and the 5 T's. Now, I just want to make one more remark about this thing. So I'm going to zoom in over here. To give good CPR, you're going to want to change the person doing it. And remember, one of our goals here is we want to minimize any interruptions in the CPR. And so, when do we want to pause anyway? When we check a rhythm, we're going to be stopping CPR, right? So this is the perfect opportunity also to switch the guy doing CPR, okay? So let's kind of go through this, and then we'll look at it in a little bit more detail. So zoom out again. So there's our guy who's coding. Let's move this over here. Try to keep that a little bit on the screen there for us. So the first thing that we're going to do, we said, is we're going to call for help. Then the next thing that we do is we start CPR on the patient. So if you're the first person there, you do it. If not, then have someone else do it. And as other people arrive, place them on oxygen and attach them to the cardiac monitor. And you can give this by mask, by some kind of face mask. Then the next thing that we're going to do is check a rhythm. Now that we have them on a monitor, we have this step here. We're going to check a rhythm. Let's say our person has VTAC, like was seen on the monitor. So we shock them. That's a shockable rhythm. Okay, and then we do, if you remember, here we go around the circle again. After the shock, we do 2 minutes of CPR. So let's do that. And while you're doing that, at the same time, get an IV. Okay? So let's go back to our circle here. So now we're back up here. We're going to switch the CPR guy. We're going to check a rhythm and shock if we need to, right? So let's do this. Change the CPR guy. So we have to pause in order to change the guy, so that's the best time to check a rhythm at that time as well. And let's say we have VTAC still, so we shock again. So now we've checked the rhythm, shocked him, placed an IV as we went around, switched the CPR guy, checked the rhythm, shocked him again. So now the second time through, we have an IV. So let's give him one of these vasopressors. All right. So at this point, what we know is we have a shock-resistant arrest, right? Because we've given him a shock and we're back here. So we're continuing CPR, and we're going to give some kind of vasopressor. So we can give epinephrine, 1 milligram, Q, 5 minutes. Alternatively, we can also give vasopressin. That's 40 units IV. And let's go back to our diagram here, and we said, you know what? At the same time that we're giving the vasopressor, either epi or vasopressin, let's consider an airway. So let's do that here. Let's think about putting in an airway at this point too. Plus an airway. All this is all happening at about the same time. So you can have maybe one of the nurses giving the drugs while you're getting the airway ready. Okay. Another 2-minute cycle, right? We get back to here, switch the CPR guy, check the rhythm, shock if it's a shockable rhythm. So switch the CPR guy. At the same time, check the rhythm. And let's say for us again, it's still VTAC. So we shock. Okay, so now we're going around the circle for the third time. And what are we going to give? Amiodarone. So as we go around the circle, remember we have 2 minutes of CPR, which is going to be uninterrupted. While that is going on, give amiodarone. So at this point now, we've given a shock and the rhythm persisted. So we had a shock-resistant cardiac arrest. So then we gave a vasopressor and the rhythm persisted. So then now we have a vasopressor-resistant arrest. So now let's give an antiarrhythmic, amiodarone, 300 milligrams. And just so you know, you can also give a second dose of amio, 150 milligrams. So we come back here, we gave the amiodarone, and we realize, oh, now we're back here, switch CPR guy, check rhythm, shock, and then do the 5 H's and the 5 T's. Switch CPR guy, at the same time check a rhythm. We'll say ours was VTAC, and we're going to shock. During the 2 minutes of CPR that we do, which is uninterrupted, we'll do the 5 H's and the 5 T's. So let's review this real quickly, and then we're going to go into all of these in a little bit more detail. The first thing we do is we call a code. Then we start CPR on the patient, put them on oxygen, and put them on a monitor as more people come in. Then the first thing you do is you check a rhythm. When we did, we saw our patient was in VTAC. So we shocked him because that was one of our shockable rhythms. Went around and around, so 2 minutes of CPR were going on. And as we did those 2 minutes of CPR, we were also getting an IV. Then we said, hey, 2 minutes are up, CPR guy, it's time for you to switch. Now it's important for the leader to tell the CPR guy to switch, because the person doing the chest compressions is going to say, hey man, I can still do it, I'm not tired. But you know what? Most people don't realize that their chest compressions are starting to suck at this point, and so you want to make sure that you have someone fresh up there doing chest compressions at all times, because quality chest compressions are very important, as we'll talk about in a second. So we said we're going to switch the CPR guy, we're going to check a rhythm again, and if it's something shockable, we're going to shock him. So we did. Boom, shocked him again. Again, 2 minutes of CPR are going to be done right here. And at that time, we're going to give epinephrine or vasopressin. Let's say we gave epi, and we're going to consider an airway as well. Switch the CPR guy again, and then while that guy is switching, you're going to check the rhythm. If it's still a shockable rhythm, we're going to shock him. And we'll say again, we still had VTAC. So now, we're going to go again around. So far, we've given epinephrine, and we've got a vasopressor-resistant arrest. So this next time around, we're going to give amiodarone. So during the CPR, we're going to give amiodarone, 300 milligrams IV. Again, when we get back here, switch the CPR guy, check a rhythm. If it's a shockable rhythm, shock him. And then we're going to consider our 5 H's and our 5 T's. In the next video, we're going to look at some of these things in a little bit more detail.